Hi, I'm Dr. Siwy. I decided to become a doctor probably when I was about 6 or 7 years old. It really wasn't a conscious decision. It was one of those things that at my time of life, there were some programs on the television that featured doctors, and I became enamored with the whole idea. And then in school, I was very drawn to math and science. I would much rather take or solve a math problem than read a chapter in a book, for example. So just going into medicine became my goal when I was very little, and my mother helped encourage me. In her mind, doctors and lawyers were the only two professions at that time, and I really felt that being a doctor would suit me a lot better than being an attorney. I actually thought when I went to medical school that I was going to be a psychiatrist. In retrospect, that probably wouldn't have been a great idea for me, although my psychology courses in college did help me and continue to help me in treating my patients. I did decide to become a surgeon only after rotating on surgery rotation. When you're in medical school, you have 4 years of medical school, and the third year of medical school, you get to what we call rotate for a month at a time on all the different specialties, pediatrics, was one, obstetrician, gynecology is another one, surgery, medicine, internal medicine, and every single one that I rotated on I liked, and I thought, oh good, this is what I want to do. And the last one I did was surgery, and when I was on surgery, I spent 3 months, and 2 of them were at the VA hospital. One of them was at the Wishard Trauma Hospital, and as junior students, we were allowed to participate in the patient care, and it was very exciting and rewarding, and I was able to actually make a change. I could see something that we would remove, like, for example, a little cyst on a man's hand would be there, and then 30 minutes later it'd be gone, and the next day you'd go look at the incision line and you'd see it healing, and it was something that I could observe. And I really got turned on by surgery. So that's how I decided to become a surgeon. Initially, I thought I was going to be a pediatric surgeon because I was really fond of the Children's Hospital. I was at Riley Hospital here in Indianapolis. I did all of my training at Indiana University, including my undergraduate work was in Bloomington, and went to medical school here at IU in Indianapolis, and then did all of my training, both general surgery followed by plastic surgery training here in Indianapolis. I thought, wow, this is great. These kids heal so fast. I really wanted to operate on children, and it was so exciting to me. And I rotated on pediatric surgery as an intern in general surgery, and I thought this is a specialty that I wanted to go into. Then I rotated on plastic surgery, and it became pretty obvious that I was going to be a natural at plastic surgery. And my mentor, Dr. James Bennett, who taught me to be a plastic surgeon, realized that when I was rotating, and he offered me a spot in the plastic surgery residency program, and I said yes. And the good thing about plastic surgery is it's head-to-toe surgery. I can operate anywhere, and I'm very comfortable operating anywhere on the body from your head down to your toe. I also can operate on children, which was good, and because I originally thought I'd be a pediatric surgeon. In fact, I was co-director of the Riley Oral Facial Clinic for 7 years when I finished my plastic surgery residency, in addition to doing burn surgery at Wishard Hospital, which I directed the Wishard Burn Unit, which now I guess has been replaced by Eskenazi, but it used to be Wishard, and it was a wonderful place to work, and we saved many, many burn patients, and it was a great experience that I really, really loved. I did decide to leave the medical center after Dr. Bennett retired. He was more than a mentor to me. He was more like a father, and I decided to branch out and go out on my own. So I opened my solo practice about 1992 up on the north side of Indianapolis, affiliated with St. Vincent's Hospital.